Okay, so this is Physiology video 2. Quick recap of what I looked at in Physiology video 1, in case you haven't seen that one. It was mainly aimed at respiration. We looked at hypercapnia, hypocapnia, dead air spaces, hyperoxia, hypoxia, respiration. You can find that video if you go to my website www.goprocaribbean.com/dive-theory, and then you want to look for the physiology section. So, in this video, I'm going to look at barotraumas, the circulatory system, carbon monoxide, carotid sinus reflex, lung overexpansion, decompression sickness, the ear, and aquatic life injuries. So, what is a barotrauma? Well, if you watched video 1, hopefully you now know that baro means pressure and trauma means injury. So, it is a pressure-related injury. When we descend, the pressure increases. And this can cause a pressure-related injury. It's often referred to as a squeeze. The most common place you are likely to experience the pressure is in your ears. However, there is actually such a thing as a mask squeeze. You may have actually seen someone ascend from a dive looking like they've got two black eyes, and that was because they failed to equalize their mask by exhaling into it through their nose as they descended. And a very unlikely thing to happen, but it is just possible, if you were to really exhale in order to make yourself sink, because perhaps you're wearing not quite enough weight, and you try and push all of the air out of your lungs and then you descend rapidly, you could theoretically squeeze your lungs doing that, but it's extremely uncommon. Now, the important thing to realize is that a barotrauma can happen during descent, but it can also happen during ascent. The decreasing pressure as you ascend can also cause a pressure-related injury. In the ears, this is referred to as a reverse block. But the most common and obviously most serious is the lung overexpansion injury you could get if you hold your breath while you are ascending. Or it could be caused by other reasons. It could be caused by some kind of obstruction in your lungs, be it as a result of a cold and chest congestion, or perhaps your lungs could be obstructed because the tubes in your lungs have stuck together because you've lost the protective coating called surfactant as a result of maybe smoking. Any of those things can cause a lung overexpansion injury as you ascend. So, barotraumas can happen during either descent or ascent. The next thing I want to discuss is circulation. The circulatory system transports oxygen to the cells and removes carbon dioxide. Amongst other things, food molecules and other waste is also removed by the blood and the circulatory system. So hemoglobin is a very important protein in your blood, and it is the hemoglobin that transports oxygen, or at least it's the hemoglobin that transports the majority of the oxygen that your blood transports around your body. It's a protein that oxygen bonds very readily to. It's found in the red blood cell. There is one other gas that bonds very readily with hemoglobin. It bonds even more readily with hemoglobin than oxygen does, and that gas is carbon monoxide. And that is why carbon monoxide is so dangerous to us. If we are breathing too much carbon monoxide, and it's too much isn't very much, if we're breathing just a little bit of carbon monoxide, what's going to happen is that the hemoglobin, instead of transporting oxygen around our body, which is what we need it to do, carbon monoxide will be binding with that hemoglobin, taking up the space of the oxygen, and causing us to, our cells to die because they're not getting the oxygen they need. Understanding a little bit more about carbon monoxide poisoning. It reduces the supply of oxygen to our cells because it's bonding with the hemoglobin in the place of oxygen. I almost liken it to an internet connection. If you are on the internet and suddenly your connection gets really slow and it becomes almost impossible to even load a simple web page, who are you going to blame? Well, probably someone else who's on that same internet connection, and you realize that someone else is somehow hogging all the available bandwidth. Perhaps they're watching YouTube videos, and that person is almost like carbon monoxide. The carbon monoxide is hogging the bandwidth of your blood's capacity to transport oxygen, in the same way that someone downloading large files on an internet connection is hogging the capacity of your internet connection. Key things to remember: oxygen bonds very readily with hemoglobin. However, there is one other gas that bonds even more readily with hemoglobin, and that is carbon monoxide, and that is how carbon monoxide can kill us. What are the symptoms of carbon monoxide poisoning? A headache, confusion, fatigue, cherry red lips and fingernail beds is a sign of carbon monoxide poisoning, and of course loss of consciousness as well. Carbon monoxide is particularly dangerous because it actually has no odor, so there is no way to know you are breathing carbon monoxide. Having said that, the cause of carbon monoxide is usually burning fossil fuels. So usually when you're smelling exhaust fumes or smelling anything that suggests some kind of fossil fuel is being burnt, petrol, gas, whatever it might be, you can assume that you are in the presence of carbon monoxide. If the smell of exhaust is overpowering, you are almost certainly in a situation where the carbon monoxide you're breathing is potentially reaching dangerous levels. Now, carbon monoxide is even more dangerous to us as divers. If we have a small amount of carbon monoxide in the tank we are breathing from, and then we descend to depth with that tank, obviously the increased pressure we're under increases the partial pressure of the carbon monoxide we are breathing. You can learn more about that in my physics videos, in the partial pressure videos, explaining how the partial pressure of any gas is increased with depth. So basically, if you were to dive to, let's say, 30 meters, which means you're under 4 atmospheres of pressure, and you were breathing 1% carbon monoxide from the tank, well, at 30 meters, it would be as though you're breathing 4% carbon monoxide. So the effect of the carbon monoxide is steadily increased by the increasing pressure. Okay, now we can have a look at carotid sinus reflex, another question you might have in your exam, your physiology exam. On the picture there, you can see that the carotid arteries are in the neck. Now, these are the arteries, obviously, that supply blood to your brain. And there are sensors called carotid sinus receptors that monitor the blood pressure in these arteries. It's obviously these arteries that are supplying blood to your brain are kind of the most important arteries, if there can be one artery that's more important than another. So very sensibly, our body has placed our blood pressure sensor on the most important artery in our body. Basically, what do these sensors do? Well, if they are monitoring the pressure and they sense that your blood pressure is getting very high, they will basically send a message to your heart, telling your heart to slow down. If your heart gets this message saying slow down, and then the carotid sinus receptor still senses high pressure, it's going to tell your heart to slow down even more, and so on and so forth, which is fine if what it is sensing is truly your blood pressure. But if you are wearing a wetsuit with a very tight neck seal, or perhaps a hood with a very tight neck seal, that could actually be putting pressure on your carotid arteries and your carotid sinus receptors. They would sense this pressure as blood pressure, and basically this pressure they're sensing from outside your body, caused by this tight hood or tight neck seal, will cause them to send a message to your heart to slow down, and the pressure will remain, and it'll make your heart slow down more and more and more, because the pressure doesn't go away. The pressure is an external influence, and eventually your blood pressure could get so low and the supply of blood to your brain could get so low that you would lose consciousness. So That is why we always need to avoid wearing a very tight hood or tight neck seal. It can cause carotid sinus reflex, which causes you to lose consciousness due to a lowered blood pressure and lowered blood supply to the brain. The next one I'm going to look at is lung overexpansion injuries. If you suffer a lung overexpansion injury, the air escaping from your lungs has got to go somewhere. And there are basically 4 different places that it could potentially end up. The most serious type of lung overexpansion injury is an arterial gas embolism, sometimes referred to as AGE. And this is where the air escaping from your lungs has managed to force its way into your bloodstream. So you now have a bubble or bubbles of air floating around in your bloodstream, and that could of course block off the flow of blood to a particular part of your body. And given it's air, it's likely to work its way upwards, so the part of your body it is therefore most likely to end up blocking the flow of blood to is your brain. So that is why it is such a serious type of lung overexpansion injury. If you lose the flow of blood to your brain, you'll have stroke-like symptoms, and it can obviously kill you. Arterial gas embolism is also the most common lung overexpansion injury. It's extremely likely, if you suffer a lung overexpansion injury, that some of that air that's escaping from your lungs will end in your bloodstream. Pneumothorax is another name for a lung overexpansion injury, and this is where the air is collecting inside your rib cage. If you imagine your lungs inside your rib cage here is basically creating a barrier, stopping the air going anywhere. So the air is coming out of your lungs into your rib cage, and that air is expanding. With every breath you take, maybe more air is escaping your lungs and filling your rib cage even more, and it is pushing your lung closed. Obviously, also, if you end up with some air in your rib cage, as you ascend, that air that's in your rib cage will expand and push your lung close. It will collapse your lung, and that is a pneumothorax. Another diagram there illustrating how the air trapped inside the rib cage is forcing the lung to collapse, and that's a pneumothorax. So mediastinal emphysema is another type of lung overexpansion injury. And this is where the air has escaped from your lungs and collected in the center of your chest, as shown by the diagram here. It can put pressure on your heart. Obviously, you'll be experiencing severe chest pain. And it's a sort of fairly easy one to remember when you look at the word media. That means middle, and therefore the middle of the chest is where the air is collecting when you have a mediastinal emphysema. And this one very often goes hand in hand with the 4th type of lung overexpansion injury, which is a subcutaneous emphysema. You may be familiar with the word subcutaneous, you may not. If you have any kind of medical background, subcutaneous injections are injections that should be given just below the skin. So subcutaneous means just below the skin. And usually what happens is that the air travels up in your body, and the escaped air collects around your neck, and you will experience maybe a swollen neck, voice changes, crackly skin around your neck. What are the causes of lung overexpansion injuries? Well, you probably know them, breath holding being the most obvious. I've already mentioned them. Chest congestion, causing a blockage in your lungs, or the loss of protective coating, the surfactant, which causes your lungs to stick together, stopping air escaping as it expands and you ascend. And this is most often caused by smoking. Now, I'm going to assume that you are familiar with the signs and symptoms of decompression illness. If you're viewing these videos, you're probably doing your dive master or instructor course, so you should already be pretty familiar with these from your rescue course. I think it's almost easier to talk about what are not symptoms of decompression illness, which I will do in a minute. But basically, one thing to think about is the fact that the signs and symptoms of a lung overexpansion injury usually occur almost immediately after a dive, whereas decompression sickness tends to be more delayed. So if you get a question listing a few symptoms and the question says almost immediately after a dive, you should be probably thinking to yourself, oh yeah, lung overexpansion injury is the answer to this one. If it's a period of time after you've surfaced from a dive that these symptoms become apparent, or the signs become apparent, that's when you're more likely to think it might be decompression sickness, DCS. So you will find a few questions in the PADI exams where the time at which these symptoms become apparent is important to deciding whether the answer is lung overexpansion or DCS. Quite frankly, as a diver, it doesn't really matter which of the two it is. The treatment for both of them is the same anyway. What is decompression sickness? Well, it can be characterized by dozens of seemingly unrelated symptoms with varying severity. It is almost easier to list what isn't a symptom than what is a symptom. A fever is not a symptom of DCS. One of the reasons I actually put this in is personal experience. A dive customer came up to me in a beach bar one evening saying that he thought he had DCS, and he had serious pain in his joints, a very, very bad headache. And he gave me a lot of cause for concern. So I phoned up the local chamber, which fortunately is very nearby here in Roatan, and managed to get on the phone with the hyperbaric doctor, who spoke to this person and told me to put him on oxygen and take him into the chamber. When we got to the chamber, we actually arrived at the chamber before the doctor did. It was late at night, the chamber wasn't open, and we were sitting outside waiting for the doctor to arrive, and it was actually at that moment that I suddenly realized he was shivering. And it was a very hot, balmy, tropical night. I was sweating and he was shivering, and I suddenly realized, oh no, he's got a fever. I've completely wasted everyone's time here. That fever suggests that it's not DCS, that these symptoms are probably related to whatever is also causing his fever. It turned out that he had dengue fever. So the symptoms of DCS could manifest very quickly, but they usually take a while to appear. After a dive, you may actually have tiny bubbles of nitrogen in your body, but you show no symptoms of DCS. These bubbles are referred to as silent bubbles. Now, it's silent because they're non-symptomatic, but a way I like to remember this is that when the RDP was being tested, one of the things used to identify whether there were bubbles in someone's body after a dive was using an ultrasound. So I like to think about it in terms of, well, bubbles that don't show symptoms and cannot be seen by an ultrasound are therefore silent bubbles. So what can contribute to DCS? Pretty much anything that may affect your circulatory system is the simplest way to think about it. So anything that affects your circulatory system. Your age, as you grow older, your circulation and your circulatory system tends to degrade a little bit. Your level of fitness, the fitter you are, generally the better your circulatory system is. Obesity. Fat is a tissue that doesn't have a very good blood supply. So tissues with a poor blood supply are likely to increase your chances of getting DCS. Smoking affects your circulation and therefore can increase your chances of getting DCS. Alcohol actually thins your blood, therefore changing your circulation and potentially increasing your chances of DCS. Dehydration, again, makes your blood thicker, changing your circulation. Injury or illness, blood supply to injuries is altered, or when you're ill, that can also change your circulation and therefore increase your chances of DCS. When you exert yourself, obviously your blood flow increases dramatically, your heart's pumping faster, pumping blood around your body quicker. So therefore that might actually increase your chances of DCS. If you've already looked at some of my RDP stuff, you might remember that one of the things that you need to do when planning a dive that you're going to exert yourself heavily is actually plan the dive as though it's 10 feet deeper than it really is, to add some conservatism to your dive planning due to this fact. One very little known factor, and something I have actually seen myself on more than one occasion, is someone after a dive in reasonably cold water, getting very cold, they then take an extremely hot shower immediately after the dive to warm themselves up. Amazingly enough, that can cause DCS, skin bends. Again, obviously taking a hot shower significantly increases the flow of blood to your skin, and therefore can actually cause DCS. So never take a very hot shower after a dive. Carbon dioxide can actually increase your chance of getting DCS, and cold, very much like exertion, it's going to slow the supply of blood to your extremities, and if it's affecting the flow of blood around your body, it can increase your chances of getting DCS. Diving in cold water is another time we should add conservatism to our dive planning by planning the dive as though it's 10 feet deeper than it really is. Now I'm going to show a little bit of a video that tries to explain how administering oxygen benefits someone who has suspected DCS. So here what we're looking at is the alveoli of your lungs. That is where the gas exchange takes place in the respiratory and circulatory system. So what I want you to imagine is that we have got the air in our lungs, in our alveoli, and this line, dotted line here, is trying to sort of imagine the semi-permeable membrane that is your alveoli, and then you've got your blood on the other side of this semi-permeable membrane, and you're breathing three gases, or at least three gases are present in your lungs and in your blood. We're simplifying it a little bit. You've got oxygen, nitrogen, and carbon dioxide. Let's imagine there's always a little bit of dead air space, so let's imagine the percentage of oxygen in your blood is 20%, nitrogen is 79%, carbon dioxide is 1%. And your blood is coming back to your lungs, and it's dropped off oxygen and it's picked up carbon dioxide. So there's 10% oxygen, 79% nitrogen, 11% carbon dioxide. These numbers are just to illustrate a point. They're not factually correct. So I'm turning these percentages into partial pressures now. So we have a total of 1 atmosphere gas pressure. We're at the surface, at sea level. We're under 1 atmosphere of pressure. So what happens is, because the partial pressure of the oxygen in our lungs is higher than the partial pressure of the oxygen in our blood, oxygen moves from our lungs to our blood. And the carbon dioxide oxygen partial pressure is higher in our blood than it is in our lungs, so carbon dioxide is moving out of our body, blood into our lungs. So that is basically the respiratory system. Let's now imagine we have just surfaced from a dive. We're supersaturated, and the gas pressure in our blood is 2 atmospheres of gas pressure. We're breathing air on the surface, so the gas pressure in our lungs is 1 atmosphere, but the gas pressure in our blood, because we've just surfaced from a dive, is 2 atmospheres. So let's just double all these numbers that we had to represent the increased gas pressure in our blood as we've just surfaced from a dive. And we've got the same pressure on either side now. It's not actually going to be correct to what would really happen when you surface from a dive, but the numbers I've picked means that there's almost no exchange of oxygen going on at this particular moment. The difference between the amount of nitrogen in our air that we're breathing and in our blood is significant. We've got a 0.79 partial pressure difference. So there is a huge amount of nitrogen flowing out of our blood into our lungs for us to exhale. The carbon dioxide levels in our lungs, if we were to double that number as well, would also be, given these numbers we've got here, bigger. So carbon dioxide would be leaving our blood into our lungs more quickly than it was in the previous example as well. So what we've just illustrated there is off-gassing when we come up from a dive, and why nitrogen leaves our blood after a dive. Now, let's imagine that we believe we've exceeded the limits and we're worried we have DCS. We decide to breathe pure oxygen. Well, what are we changing? We're changing the partial pressure of the gas in our lungs. The partial pressure of oxygen is no longer 0.2. We're breathing pure oxygen. The partial pressure of the gas in our lungs is 1. Therefore, we've got a 0.8 difference between the partial pressure of oxygen in our lungs and the partial pressure of oxygen in our blood. So we have a lot of oxygen now flowing into our blood. If we're breathing 100% oxygen, that means we're breathing no nitrogen. So the partial pressure of nitrogen in our lungs is 0. So now, instead of there being a 0.79 difference in pressure, there's a 1.58 difference in pressure. So what we are doing is we are increasing even more the rate at which the nitrogen is flowing out of our blood into our lungs for us to exhale it safely. As long as the nitrogen is coming out of solution in our lungs, it's a good thing. And then finally, carbon dioxide, there's a very small change there. So what you can see we just did there was by breathing pure oxygen, we reduced the amount of nitrogen in our lungs, the partial pressure of nitrogen in our lungs. And it was actually reducing the partial pressure of nitrogen in our lungs that increased the amount of nitrogen that was coming out of solution in the good place in our lungs where it can come out of solution. So we've increased the rate at which we can safely eliminate the nitrogen through perspiration. We dropped the partial pressure of nitrogen from 0.79 to 0, and that is why we breathe oxygen. If we suspect DCS, it's actually to reduce the partial pressure of nitrogen in our lungs. Okay, so now let's have a look at the ear. Here is a diagram of the ear, and I just want to look at some of the aspects of the ear that you might be asked questions about in your PADI exam. Delayed equalisation. Delayed equalisation can cause the eustachian tube to become blocked. It's kind of squeezed closed by the pressure, and actually it gets blocked off. And then equalisation becomes pretty much impossible with a blocked eustachian tube. So that actually explains why, if you descend and you start feeling pressure in your ears and you're having difficulty equalising, the reason you may well be having difficulty equalising is because your eustachian tube has been closed by the pressure you're under. And that is why you need to ascend a little bit to let your eustachian tube reopen and then try equalising again. The next one is one that I think happens quite a lot, actually. If you've ever surfaced from a dive and you've got a feeling like there's water stuck in your ear, well, it may very well be that it's just water in your outer ear. But that feeling of water in your ear might be in your middle ear. And if you have been swimming around slightly unequalized for a little while, then basically you've got a low pressure in your middle ear. And what's happening is actually the blood and mucus in your middle ear is being sucked out of the tissues of your middle ear. I think one of the best ways to think about it is if someone gives you a love bite or a hickey, something that probably most of us have experienced at some stage or another as children, or if you stick a vacuum cleaner up against the skin of your arm or something, obviously you get a very, very deep, vivid red blotch. Well, that is low pressure caused by the vacuum or someone giving you a hickey, and it's literally sucking the blood in your skin to the surface. Well, in your middle ear, if you create this low pressure environment for an extended period of time by not fully equalizing during a dive, you're getting this blood being sucked out of the walls of your ear and it's collecting in your middle ear. And that could give a feeling like you've got water in your ear, but no amount of tilting your head to the side and banging the side of your head is going to get rid of it because it's the wrong side of your eardrum. So obviously at the same time you did this, you are also likely to get a bunch of inflammation around your eustachian tube, and that would mean that you would have difficulty actually allowing this blood to drain out of your middle ear as well. So you might well need to be taking ibuprofen or something to reduce the inflammation in your eustachian tube to help the blood and mucus drain from there, and you would certainly probably be out of the water for a little while. So what other parts of the ear do we need to know about? Well, a very forceful equalisation, a very forceful Valsalva equalisation. The Valsalva technique is where you pinch your nose and blow against blocked nostrils. If you do that too forcefully, it could cause your round window to rupture. A forceful Valsalva technique, a forceful equalisation can cause round window rupture. Okay, and that round window there, it's a kind of fairly weak membrane on the sac of your middle ear, and it's obviously where a lot of your sense of balance is determined. So damaging that can result in immediate severe vertigo and nausea. Interestingly, if you use the Frenzel technique to equalize, which is a hard technique to describe, you probably as experienced divers know what I mean when I say you just pinch your nose and do something in the back of your throat, and that equalizes you. Well, obviously, it's very hard to do that in a forceful manner, so you're unlikely to rupture your round window using the Frenzel technique. It's that Valsalva technique where you can actually create enough pressure in your middle ear to potentially rupture your round window. Aquatic life injuries. So with aquatic life injuries, what are the different possible types of aquatic life injury? Well, one fairly obvious one is a bite. Stings is another type of aquatic life injury. Cuts is another one. And of course punctures is another one. So looking at these four different types of aquatic life injuries, what are the signs and symptoms of them? Well, bites are fairly obvious. There's someone who's got a nasty bite on his hand from feeding a moray eel. Very foolish thing to do, but they're pretty damn obvious signs and symptoms if you get bitten. Stings is a very interesting one. Stings can be very serious.
Off Australia's northwest coast, a pearl diver has been stung by a deadly Irukandji jellyfish and is battling enormous pain. That stings are generally regarded as the most painful on Earth.
Feels like it's shut down.
So their pulse rate accelerates, obviously, they're in a lot of pain, and their blood pressure just goes through the roof. It's coming down. It's good. These guys are very young, fit males. If you had a heart condition or something like that, you may be in a bit of trouble with an Irukandji sting. Morphine.
With morphine and an antipsychotic drug, he is now stable. Despite the painful ordeal, he was keen to dive again 24 hours later.
So what we just watched there was a video about the Irukandji jellyfish, most commonly found off the northern coast of Australia, although it can theoretically possibly be found in other areas. And it is absolutely tiny, very, very small jellyfish, and the sting can be so serious that it actually causes you to die in a very short space of time. You'll suffer from such severe shock that your respiratory and circulatory system will fail. So stings are an aquatic life injury that can cause respiratory depression or arrest, or circulatory depression or arrest. and that's an important fact to remember for your physiology exam. Something that isn't a sign or symptom of a aquatic life injury is euphoria. What else might we get from, again, fairly obvious, cuts can become infected, and punctures is another type of aquatic life injury, and puncture wounds are very often associated with severe swelling. Here is the hand of someone who was got by a lionfish while lionfish hunting. You can see his right hand there is significantly swollen as a result of that puncture wound. So those are the things to know about aquatic life injuries. And that finishes Physiology Part 2, and it actually finishes my planned physiology videos that I've got planned at the moment. I may come up with some other things I want to discuss, but at present, that's it for physiology. We've looked at, over Physiology 1 and 2, the Greek origins of important words, hyperventilation, respiration, circulation, lung overexpansion injuries, DCS, the ear, and aquatic life injuries. So if you are finding these videos useful, please share them with people. It's great if you can put links on any blog you have, or on any website you have, or any forum post you're making. If people are asking questions about where to study for the instructor exam or the dive master exam, please answer those questions, and please publicize how helpful these videos have been to you by linking to my website, ideally www.goprocaribbean.com/divetheory. That is where the people you're trying to help will be directed to the most useful compilation of these videos, displayed in the order they're intended to be displayed in.